The tradition I'm most excited about passing down to my babies is dancing together at home when the music comes on.
The tradition that I am most excited about passing on to my baby is matching holiday PJs.
Teaching them the gospel songs I grew up with.
Teaching them how we celebrate Kwanzaa and the principles behind it.
The cultural tradition that I'm excited to pass on to my baby is our stories that have been in our family for generations.
I can't wait to pass down my grandma's sweet potato pie recipe.
The tradition I'm most excited to pass on to my baby is to celebrate his birthday in a big way. But I also worry about what illnesses might get passed on to him. That's why I got him Beyfortus.
I am being compensated for sharing my story with you in this video. The first time I found out I was going to be a mom, I was excited. I was overjoyed. A bit overwhelming because we don't have a lot of family around. Most of our family is in Ghana, West Africa. I knew about RSV because of my health training, and when Nolan was exhibiting labored breathing, I knew it was time to take him to the ER. Even as a healthcare provider and seeing lots of kids who are not well, when it's your own kid, you freak out. That moment, you're not a nurse, you're a mom, you're a parent, and all you want to do is make sure that your baby is fine. That moment was very scary, to see your child who seemed so helpless and was having trouble breathing, and you can't do anything about it. We learned about Beyfortus at Liam's pediatrician appointment. This was 2 days after he was born. Our baby's doctor told us that there was a way to help prevent serious RSV lung infection. When he said Beyfortus would be a good idea for Liam, of course we said yes, because we did not want what happened with Nolan to repeat with Liam. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. He shared that the most common side effects include rash and pain, swelling or hardness at the site of your child's injection. We had been through a rough experience and wanted to take whatever preventive measures that were available. We are very glad Liam received Beyfortus. Thankfully, he has not had any symptoms yet of cold or RSV. It's important for me to tell my story because I'm a nurse practitioner, but I'm also a Black woman from Ghana. I understand why there's an uncertainty in trusting healthcare providers. And I hope me sharing my story will give others the initiative to research Beyfortus to see if it would be a good fit for their little one.
Important safety information. Your child should not take Beyfortus if your child has a history of serious allergic reactions to nirsevimab-alip or any of the ingredients in Beyfortus. Before your child receives Beyfortus, tell your healthcare provider about all of your child's medical conditions, including if your child has ever had a reaction to Beyfortus, has bleeding or bruising problems. If your child has a problem with bleeding or bruises easily, an injection could cause a problem. Tell your healthcare provider about all of the medicines your child takes, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Your infant should not receive a medicine called palivizumab if they have already received Beyfortus in the same RSV season. Serious allergic reactions have happened with Beyfortus. Get medical help right away if your child has any of the following signs or symptoms of a serious allergic reaction: swelling of the face, mouth, or tongue, difficulty swallowing or breathing, unresponsiveness, bluish color of skin, lips, or under fingernails, muscle weakness, severe rash, hives, or itching. The most common side effects of Beyfortus include rash and pain, swelling or hardness at the site of your child's injection. These are not all the possible side effects of Beyfortus. Call your healthcare provider if you have questions about side effects. Indication: Beyfortus is a prescription medicine used to help prevent a serious lung disease caused by Respiratory Syncytial Virus, RSV in newborns and babies under 1 year of age born during or entering their first RSV season. Children up to 24 months of age who remain at risk of severe RSV disease through their second RSV season. Please see the full prescribing information, including the patient information, in the adjacent links.